Hi everyone, we're going to be looking now at a hamstring and calf massage with a little bit added in for the foot. And what I've done first of all is made sure that my client is comfortable, she's covered at the top, and the leg that is not being massaged is covered too. You can see that her skin is exposed from the bottom of the glute all the way down. And I'm going to now apply some oil for her. So you need to make sure, in my experience at least, that you have enough oil or lotion so that you're not pulling on the person's skin. You can see I'm leaning forward. I'm using both hands now just to get into those muscles, and I'm keeping my back relatively straight. You can use different techniques. What I like to do is to use my thumbs with my body weight behind them, because that way I know that I'm getting in deep enough, albeit slowly deeper. But the thumb I find is quite good for getting right into those muscles. So my thumb right now is on her iliotibial band. I'm just moving up her leg. Not too fast, I'm going quite slow just to make sure that it's not too painful for her. And my other fingers at the moment are on her hamstrings. So I'm now moving to the other hand. I have my thumb going round the adductor area and onto the hamstrings. And now I'm alternating hands. So she's getting quite a deep massage now. Going up into the glutes. It's important you go all the way up. What we don't want is to miss the attachments. Those tendons also can get very, very tight. So we want to make sure we're going up the entire length of the muscle into the tendons, and then we can be sure that that muscle is more relaxed. So from here we're going to look at moving down into the calf area. Remember to ideally start at the top and do the bottom section of the limb afterwards. So in my previous video you would have seen that we start hamstrings and then move on to the calf. That's for blood flow reasons and circulation. So when we look at the calf, you can see again I'm using both hands. I'm also alternating to one hand, and the pressure I'm using at the moment is through my thumb. So what I'm doing here is the gastrocnemius, not moving too much because it's a small area and I don't need to shift my body weight too much. But again, I need to make sure that my back is comfortable and I'm standing close to the bed. If you're standing too far away, you might get backache, particularly lower backache. And make sure too that you're not hurting your hands. You need to use a technique where you're comfortable and you're not hurting yourself. So when I do her calf, just like the other leg that we did earlier, I make sure that I don't touch the back of her knee. It's very sensitive and we don't want to hurt the person. That area there is called the popliteus, just here behind the knee, and I'm going to leave that. So I'm working up her calf muscle through the gastrocnemius on both sides, the medial and lateral side, and I'm going up into her soleus with my thumbs. This is also quite good if somebody has a tight Achilles tendon down here. Of course, it's all connected, so we want to loosen up the whole leg, not just part of the leg. And loosening up the calf will definitely help with loosening up the Achilles tendon and also loosening up the foot. So while I'm doing her calf, I'm also massaging the tendon at the bottom of her foot, just to show you it's the central area at the top of the foot, and I'm moving from the heel down towards the big toe area. So I hope you've enjoyed this video too. I will be doing some more, of course, and enjoy your practice Have fun. Remember to look after your clients well. Make sure the bed looks nice and presentable. Make sure that their head's comfortable. Make sure that they're covered nicely so they don't feel uncomfortable or exposed in any way. And make sure to always ask your clients if they are okay, if it's too deep, or if there's anything they need. And another point I wanted to add was I find it very, very nice and polite to smell good, to look clean when you do your massage clients, and also to offer them water before or after, or both, their treatment. So all the best of luck. I hope you're enjoying the videos, and I look forward to seeing you for the next ones.